This slide of the artery again, we can see here, this is an artery, this is a vein. We can see here there's an arteriole, there is a venules. Again, we have a vein here. We have arteriole, venules, arterioles, and here we have the veins. And we can see here this the structure. These are the nerves. As I said in the lecture, any artery or vein contains three layers: the tunica intima, which is the simple squamous epithelium with the layer of the subendothelial connective tissue, and then we have the tunica media, which is mostly consists of smooth muscle, and finally here we can see the area of the tunica adventitia. So if we increase the magnification, we start to see this epithelium, which is the simple squamous epithelium, the endothelial, and here's the tunica media, the tunica adventitia. If I increase the magnification again, you can see here all of these cells are the endothelial, and we can see here this connective tissue, or just beneath the epithelium, which is the subendothelial connective tissue. And the pink line here, you can see this pink line here, this is the internal elastic lamina, and usually the interelastic lamina limits the tunica intima from the tunica media, and inside here we have the tunica adventitia. So if we increase the magnification again, this is the epithelium, the simple squamous, and this is the underlying connective tissue, subendothelial connective tissue, and this pink line here, which is the internal elastic lamina, as I said, it limits the tunica intima from the tunica media. Inside the tunica media, we can see all these cells, which are the cigar shape. These cells are smooth muscle cells, and these cells forms the tunica media. Outside here, we have another line, sometimes we can say it in this area here, which is the external elastic lamina, which limits the tunica media from adventitia. And you can see here, this is the tunica adventitia, which is the dense irregular connective tissue. Sometimes we can see blood vessels or nerves in the tunica adventitia, which is the nervi vascularis or the vasa vasorum. If we go to this area here, just go back a little bit in magnification. This is the area of the vein. This is the tunica intima, media, and adventitia. As I said, the tunica media sometimes is absent or very limited, and the prominent feature is the tunica adventitia. One important also structure we could see in the vein, this is the the valve. As I said, the valve is found in medium-sized to large-sized veins, okay, and they are an extension from the tunica intima. Outside we can see the simple squamous epithelium, and just beneath the epithelium we can see some subendothelial connective tissue. If we go to this area here, again we have venules, and we can see the valve. As I said, it is an extension from the tunica intima. Whereas here we can see this is an artery. Again, we have the tunica intima, tunica media, and outside we have the tunica adventitia. And it's very easily to differentiate between them. Mostly the artery, the wall is regular versus irregular in the vein. One other feature is the valve only found in the vein. We could not see them, and they are not exist in the arteries or arterioles. Again, here we have a venule, small size vein, and here we have a very small arterioles. As I said in the lecture, 1 to 3 layers of the smooth muscle, this is considered as an arteriole. More than 3 layers, then it's considered as an artery. Again, here we have, you can see this is a regular wall and it's the vein. If we go to this area here, again, this is a venule, this is a vein, very large vein, again with the valve. We can see inside it. Here we have an arteriole. See here, this is again an arteriole, and we can see here this is a venule. Again, this is a venule. Again, this is the vein with the valve. Another important structure we can see in this slide, we can see a nerve, and we can see here it consists of bundles, and this is the whole nerve and surrounded by another connective tissue. This connective tissue that surrounds the whole nerve, this is the epinerium, which is the dense irregular connective tissue, and here which surround each bundle, this will be the perineurium, and inside we have the axon, which is surrounded by the Schwann cells, and these Schwann cells are called the endoneurium. See here, this is the area. Increase the magnification a little bit. See here, this is the bundle and surrounded by this connective tissue, which is the perineurium, and this space here is the perineural space, which is filled with the cerebrospinal fluid. And we can see here, this is the axons where it's surrounded by the Schwann cells. When we have this donut shape, this indicative of the formation of the myelin sheath. And when we have just only small axons without this myelin sheath, this is considered as the non-myelinated nerves. So all of these are nerves, and we can see here this is the donut shape, and here we can see this is donut shape or tire shape. And when we don't have this myelin sheath, this is considered as non-myelinated axons, and when we have this, we consider it as myelinated axon. Very important, in the nerve, in the same nerve, we could find some myelinated axons, and we could find the non-myelinated. And to differentiate between them, whenever we have the myelin sheath, this is myelinated, and whenever we don't have this myelin sheath, this is considered as the non-myelinated. We can see here, this is another venule, and we have an arteriole.